So my name is Kristika Kumar. My family are the Williams. I'm from Wreck Bay, New South Wales. I'm a Wadi woman and a part of the Yuin Nation. I work at Wominda as an Aboriginal health practitioner, registered, and an ITC coordinator, which is a chronic disease program.
Kristika, great to have you along. Tell me, how did you become an Aboriginal health practitioner?
Well, I actually started at Wominda probably 10 and a half years ago now and worked as a receptionist. I saw what our other health worker was doing, just one at the time, and I thought, you know what, I'd love to do what she's doing and help the aunties, help our mob, help our women in community. So I started studying a couple of years later at the Aboriginal Health College in Little Bay in Sydney, and that opened up many doors. Now, I went on to do the next course and became registered a few years later with APRA, and haven't looked back since. It's been about 6-7 years now since I've been registered, and I absolutely love it.
What does it mean to you to be able to help your community?
I was one of those women once that needed to reach out and have that culturally safety worker, a familiar face, mob from our community, and sometimes there was barriers to access those sort of healthcare services. So I thought, you know what, if I was one of those women that can be there for our community, create that safe place, then I want to do that. So it means everything to me. It just helps, get our people into services, have that access, have that safe place. So it means everything. I live by it. It's my purpose. Yeah.
I love that when you say it's your purpose.
Yeah.
How important is it to have that cultural integrity wrapped around healthcare?
Oh, it's very important, just to have that wraparound approach, a strengths-based approach, and be able to understand community, taking into account some barriers and the reasons why there's fears towards health services or lack of trust or reasons why people won't access that. So just being able to, speak to our mob and understand their individuality and the reason, why there could be gaps or whatnot. So it is very important, and being able to provide that one-stop shop here at Wominda means everything.
Tell me, have you had mentors along the way? Has that been important?
Yeah, so we have had mentors here at Wominda. We have like a cultural kinship system. So we're mentored by our elders here. And just working alongside a couple of our RNs and GPs. It's a team-based approach here to build up our capacity as Aboriginal health practitioners. And I think, once I became educated and studied and worked as a health practitioner for a while, I'm now doing that with the younger ones here. So, mentoring them through their studies and then post-study as well. So, what we do and what we learn here, we pass it on to build up our knowledge, I guess, and experience as health practitioners.
How does that feel for you now to be the one doing the mentoring and passing on that knowledge and skill and understanding?
I love it. I feel I'm so grateful. Like we learn something off each other along the way, There's always something that we could learn and share as well. And just seeing these other young ones come through shining, it means everything to me. It's a domino effect, really. We need to pass that on and build up our future generations. And that's what's happening here. And I love it.
And Kristika, about what does a day look like in your work now?
So we have GPs that work here in the clinic and other clinical team members as well, as in midwives, RNs, allied health providers.